So number 3, injections and surgery are your only options, right? Steroid injections, right? Cortisone. Cortisone, in most studies, provides temporary relief. Now, in my kind of clinical observation, about 30% of the people get good relief for 6 months or more. However, what happens is it wears off. They get the injection, they feel great, they go back to normal, they don't do anything else to help with their knee pain, their form, and they don't change anything else. And in 6 months, cortisone wears off, and then they need another injection. So they go get another injection, but this time it only lasts 3 months. And then they go get another injection, and then the third time it doesn't do anything, or it only helps for a month. And then the doctor says, well, I can't give you another one because it's not good for you to give them that close together, right? Or they give them in series of 3, but then you can't get that series of 3 for several times later. Now, studies have actually shown that when you do corticosteroids, it actually can break down the cartilage and your ligaments faster. It shows a negative effect long-term on the soft tissue structures of your knee. Okay, so that's why they don't just give it every time you want. They give it in a series of 3, and they say 3 is enough. You need to take a break because we don't want things to break down even faster. So you're kind of spinning your wheels if you're relying on injections. Now, the best way, if you are going to do an injection, is follow it up with a comprehensive rehabilitation program. So if you get an injection, your pain is down, now do some things to be able to improve your range of motion and to make sure you're strong and make sure your form is good. Now, surgery. We talked about this already. It's costly. It can be dangerous depending on your age, but any surgery is dangerous. You're going under anesthesia, and it's mixed outcomes. Now, I would say knee replacement is one of the better. Now, I would say hip replacement is one of the best surgeries as far as outcomes. Most people have a positive outcome. Knee replacement, I would say the majority of people have a positive outcome. However, there are still several people that don't have relief or still have problems after, right? So if there's a way that we can prevent it or we can do things before having surgery, that's the type of people that we like to help. I would consider it as a last resort. You've tried everything. You've been to not just physical therapy, but you've been to somewhere like natural fit therapy that spends the time one-on-one, a whole hour doing manual therapy and exercises and stretching to be able to make sure we get the root cause of your problem. And then if that fails, which rarely does, then yeah, you may need surgery. But like I said before, you'll be better off after surgery by addressing all the things before. So myth number 4, stem cell treatments. I hear it on the radio quite a bit in the Austin area right now. And I think the QC Kinetics is the one that I hear on the radio all the time. They do a great job advertising. Their messaging is very strong. But when you really look at the research, it is very new and very experimental. Insurance does not cover it. It has very little evidence, and most of the published articles are case studies. So a case study is a single person or maybe a small group of people that had a positive effect, right? There's such things as placebo and people that would get better anyways, or maybe these people had an injection and then did therapy. We don't really know. It's not enough sample size to really know if these things work or not. They're very expensive, $2,000 to $4,000 per shot, and they normally recommend a series of shots. It might be something for the next generation. They might be onto something, but it is very new and very experimental. And most shiny new things are too good to be true. We use the foundations of a healthy lifestyle, healthy diet, regular exercise, the right exercise for people with knee arthritis, and they can get better. So why do people continue to have knee pain longer than they should, right? So first off, a lot of people never start doing anything. They're just complacent. It's part of life. I get old, I get pain, I just deal with it. I'll stop playing tennis, I'll stop playing golf, I'll stop traveling, I'll just kind of give in, right? So that's one reason why. Other people give up too soon. I've tried therapy or tried to exercise. I went to the gym for a couple months and then I stopped. Well, this is an ongoing thing. If you're ready to make a lifestyle change, if you want to make sure you're doing things right, then you can't give up, right? If you want to live an active lifestyle where you travel the world, where you play golf, well, you play tennis, then you can't give up. You have to continue to keep your body in shape so that you can be active. Not performing the right type of exercises. I'll hear people say, I walk every day. My knee should be great. Well, walking is walking. There are ways to walk with poor mechanics, and it doesn't necessarily hit all the exercises that you need. I'm getting a couple messages. Okay, those were a long time ago. All right. So a lot of people don't perform the messages or the exercises in the right way, causing actually more wear and tear on their knees. Not working with experts who specialize in working with older adults, right? I hear this all the time. I work out with my personal trainer. He does a great job, and I would never stop going to him. He just keeps, he's so great, or she's so great. And I say, well, how's your knee pain? It's terrible. Oh, how are they addressing your knee pain? Oh yeah, we do a lot of exercises to get my legs strong. Good, are they getting stronger? Yeah. Oh, how's your knee pain? It's terrible. Okay, well you're missing something, right? And it takes a different lens of expertise to work with older adults. We have a lot more things going on, right? It's just more complicated. And sadly enough, there are really good personal trainers out there, don't get me wrong, but they do not have a doctorate level education behind why they're doing what they're doing, right? There's no governing body over personal trainers. You can take a weekend course and become a personal trainer. We went to school for 7 years to become a doctor of physical therapy. So a lot of people just have a new injury, right? They're doing great, and then they have a little flare up and it just kind of derails them and they get discouraged and they stop and they give up. Lack of accountability. They don't have someone to say, hey, come on, let's go. We're doing your exercises today. So whether you have a workout party, a buddy, if you have a personal trainer, after you've worked with a physical therapist, or if you have one of our wellness programs or things that we do to help people stay accountable once their knee pain goes away. And a lot of people just wait till it's too late. If someone's knee arthritis is really, really bad, like you said, there's some people that just aren't going to come back from that. They're going to need knee replacement. And even after that, it's an uphill battle. So don't wait till it's too late. Do something that you can do about it. So one thing I wanted to talk about when we talk about doing the right type of exercise, a lot of people, and even a lot of reputable therapy clinics and chiropractic clinics, they get tunnel vision and they just look at the knee joint. Let me do exercises for the knee. Let me do massage on the knee. Let me do treatments to the knee, right? However, the knee, a lot of times is just the culprit between two other joints, right? So I'm not really in a setup that I can show you, but if you can picture this, if I do a squat, my knees are meant to bend like a hinge on a door, right? However, your knees can come in together or they can splay out to the side. When they come together, they're not bending in a straight hinge position. It's putting torque on the knee. And a lot of times that's because of your weakness or awareness in your hips. Most of the time, as Americans, we sit too much. We're not that active. We don't do a lot of side-to-side activity. Our butt muscles get very weak, which then causes to have poor mechanics during squatting or walking or exercises. The other thing is your feet. A lot of people have weak ankles and weak arches and have issues with maintaining their feet, your foundation, in the right position, which then causes extra twisting at the knee joint. And every time your knees, or every time your feet collapse in, your knees follow, right? And it takes them out of that normal hinge position, and puts too much stress on the knee. So those are the things that we do differently than some of the stereotypical, let me just massage your knee, let me just give you squats, let me just make sure your quads are real strong. Yes, getting your quads strong is really important, but if you're missing really big pieces of the puzzle, then you're just going to spin your wheels. So hopefully that helped. So what are some options of working with natural fit therapy? So I told everyone that we would talk about what it would look like to work with natural fit therapy. We have one-on-one treatments supervised by a doctor of physical therapy. This is what you would consider traditional physical therapy. However, we're one-on-one the whole time. And so you're working with your therapist. They're making sure you do the exercises right. They're doing hands-on work to make sure the range of motion is good in your knee. We're making sure all the mechanics work well, right? That's where most people end up starting. We also have one-on-one wellness and personal training. So once people get out of knee pain and their knees start feeling great, we noticed when I first started natural fit therapy, I was like, I'm gonna get everyone better, I'm gonna save the world, right? And people would come to me and they'd start getting better, 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 better. I discharge them with the best exercises that they can ever do, and slowly they start going downhill. And I would see them in my office 6 months, a year later. I said, what is missing here? And I realized people get derailed. They don't do their exercises. Life gets in the way. They start doing the exercises wrong. Sometimes they'll come in and be like, I've been doing all the exercises. Watch, let me show you. And I'm like, where did you learn that? I did not teach you that. And they're not doing things right. So a lot of people will continue with our personal training, or if they're really not that bad off and they just want to prevent knee pain, they can start at one of our personal training options. We also have a group virtual wellness membership. This is great for people to bring the cost of treatment down. We do group classes right over Zoom. We do 4 a week, one that specifically works on balance, one that specifically works on strengthening, especially for the knee joint. And then we have one that works on stretching to make sure we're mobile. And then one that's a little higher pace that's good for cardio to keep your heart healthy. So a lot of people don't start there, but I just wanted everyone to be aware of what options are available. But where most people start that are new to natural fit therapy is they start with a discovery session. And a discovery session is for someone who thinks we might be able to help, but are still nervous and skeptical, and they're not really sure what to do next. So like I said, I was going to give everyone an option to be able to get one of these free discovery visits. So we have 2 options. We have a virtual option and an in-person, okay? And this is for someone, like I said, who thinks we might be able to help. They've heard some of the strategies and techniques that we've talked about today, and they said, you know what, I'm curious. I'm not sure, but I would like to talk one-on-one about my specific situation, right? And so if you go to the link there, and Victoria will drop it in the chat here shortly. Hopefully she's still with us. And all you have to do is enter your information in there, and then it will alert us that you're interested in one of these discovery sessions, okay? Now, the cool thing is if you book today, then you will actually be eligible for a free month of our virtual group wellness membership, which is a $100 value. Okay, now this is something that you most likely will use in the future, but we know that a lot of people will be on the workshop today and they'll say, that's me, I need to do something about it. I'll do it tomorrow though. And tomorrow rolls around and the dog makes a mess, or your wife asks you to do a new project around the house, or the grandkids come over for a visit, and then it's out the door and you forget about it, right? And so we want to give everyone a little bit of incentive, because we know human nature, we know how people are like, we know how to get the most out of people. And so we're going to give away a free month of that membership just to come and do a free consultation, right? So go ahead and click that. It's naturalfittherapy.com/kneepaindv. That's DV for discovery visit. If you don't want to mess with that, you are welcome to go ahead and call our clinic. Our phones will be switching off in the next like 10 minutes. So just leave a message, say I want my free discovery session and I want to make sure I get my free bonus. They will call you back tomorrow and talk to you about that.